One of the areas that has really been affected by the JAPA syndrome is actually the healthcare industry, health industry. A lot of our medical doctors are leaving, a lot of our nurses are leaving, a lot of our healthcare workers are actually leaving the country and going to other countries where you can't blame them. They are going to get better pay, better life. You're looking at, where lives matter, where you can grow, not a place where you're being owned salaries. And right now we have federal government is actually begging the healthcare workers not to leave the country, and they're also begging for those who have left to kindly return to the country. There are some hospitals where wards have been closed down because there are no doctors that will manage, and be no head doctors and other healthcare workers that will be in those places to man them. So the manpower is radically being reduced, and you know how much it takes a lot to train a medical doctor, to train healthcare workers, and it's not something that you can just say, oh, I'm just going to spend 6 months training to get people up there doing those things. And it's not just healthcare workers, all across industries. ICT, you'll be losing a lot in terms of accountants, professional services. A lot of people, the country is really losing a lot of manpower, and Nigeria has spent so much time training these people, having that access to their education, tertiary education for those who have gone to government schools, because it's really subsidized. And then the manpower that should be used to develop the country gets to other countries, and they're using them over there. I don't blame anybody who is leaving the country, because I always say if you have the opportunity to leave, because Nigeria right now doesn't respect lives, doesn't respect talent, doesn't respect our people. And so instead of just waiting and suffering, you can still go out there, get a life, and one day you'll be able to contribute to Nigeria. If Nigeria wants these healthcare workers to stop leaving, then Nigeria needs to start treating them better.